Doctors out there, what is one important thing you'd recommend everyone for their health? The best old people, strongest, healthiest, are the ones with toned muscles and purpose. Think farmers took 3 people and a shit ton of prop to get this one dude's artificial hip back before he scurried away. He was 93. As a student, remember shadowing a geriatric doc who had a 90-yo chick who dressed in pink Valor outfits and did yoga daily. She refused to use protection during sex BC, why bother? 90. While there are 50-yo in nursing homes who are so deconditioned as to be disabled and have nothing propelling them to the next day. There is no one thing anyone can do for their health as good as quitting smoking, including cannabis, as you are still getting a big dose of carcinogens. If you don't smoke, then having a healthy diet would be the next biggest thing. Get regular exercise. Eliminate alcohol consumption. If you are a diabetic, keep very good control of it. Keep up with regular checkups and don't hesitate to get something checked out if you are concerned. This is even more critical if you have a family history of cancer. I'm a dentist. Don't drink pop or suck on candies all day long. It's not a big deal to drink a Mountain Dew at lunch and a bag of Skittles after dinner or something. Just finish them quickly and don't do it between meals. If you threw a Skittle in your mouth every 10 minutes the whole day, you are going to get a bunch of cavities. If you eat a bag of Skittles in 5 minutes right after dinner, it will have essentially no effect on how many cavities you get. Oral health is often overlooked, so this is for anyone who uses a manual toothbrush. If you can afford it, buy a cheap electric toothbrush. Most people aren't great with their toothbrush technique, and an electric toothbrush makes it so much easier for most people to get plaque off. Just 2 minutes each time, twice a day, point the bristles toward the gum line at a 45-degree angle and let the electric toothbrush do its magic. Not an MD, the hospice nurse. When we reach our natural destination, the folks surrounding you are all you have left. The Harvard study shows community is very important for healthy longevity. Harvard study. Not a doctor, but a doctor told me, exercise to where you sweat at least 20 minutes a day. That means if it takes 20 minutes to build a sweat, do whatever you are doing for 40 minutes. This resonated with me and I have been doing it for past 3 years, and I look younger in my 40s than I did in my 30s. It's like magic. I'm Benjamin Button. Yes, exercise and healthy lifestyle are common, but one thing I see a lot is late presentations. So if you're having consistent pains or symptoms of any sort that are unusual, just get it checked. Okay, not a doctor, but if something looks off, even if minor, don't wait. One that I ignored for months because I believed it was normal was my bent spine. The clear divot in my side. Wear your seatbelts and helmets, they're ubiquitous for a reason, and you are not too cool for a life-altering injuries. Also, cannot emphasize enough how bad smoking is. Everybody should deposit $100 in my bank account. The extra money is really weighing you down, and the faster you get rid of it, the better you'll feel. Trust me, I'm a doctor. Doctors aren't who I'd be asking for health tips. They're not generally in the business of preventing disease or promoting health. It's typically about addressing symptoms. I asked my uncle, who is a doctor, this question about 10 years ago, and his answer was 1 glass of red wine and 2 fish oil pills a day. Both of these have been since debunked. Besides the obvious, smoking. Exercise. The amount of patients I see who do absolutely zero form of exercise is staggering. Even walking 10 minutes outside would help. Know what meds you're on and why you're taking them. Also, if you have high BP, keep track of it at home. Chances are your hypertension is only white coat. Not a doc, but a friend of mine is. I sent him this and he replied in all caps, "For the love of God, please don't hesitate to get second opinions." I'm a RD and not a doctor, but people need more fiber. Most people would benefit from a serving of Metamucil daily. Eat better and move around more. So many back troubles and mental health problems stem from lack of movement. Non-doctors replying and then also suggesting unregulated supplements is why there are problems these days. Not a doctor, but I work in a hospital. Drink some water. It's easy to get dehydrated without realizing it. Exercise regularly. Not only will you live longer, you have a better quality of life when you're older. Fuck more. Preferably your partner. Great for mental health, sexual health and physical health. Stop drinking alcohol. Seriously, alcohol is so bad for you in so many fucked up ways. Not a doctor, but drink enough water. Skip soft drinks and alcohol whenever you can. Masturbate once a day, and leave your blinds open while doing it. I too am a doctor. If you're having trouble pooping, smoke 2 cigarettes a day. I'm Dr. Gregory House. Sit back and use the backrest in your chair. Your lower back will thank you for it. Regularly brush your teeth and floss, cut sugar, get a night guard, teeth aligned. Learn about food nutrition and practice what you have learned every day. Sitting is the new smoking. Move your body. Vitamin D. Stick to the Dr. Herman Charnower diet. Avoid hot lead. Eat a bag of circus peanuts every day. I'm a doctor, a dietitian. Move your body daily. Eat a vegetable.